Now, a question that keeps me up at night, especially lately with COVID and whatnot, has been: is my healthcare racist? This is an important question. I don't think you're a critical thinker if you're not asking these questions. So let's look into what Boston is doing about that at a hospital called Brigham and Women's with a pilot program. Um, so really quick, we see that Boston area hospital is to offer preferential care based on race. We're going to dig into it, look at some of the data that's supporting it, um, and then hopefully empower ourselves to draw some conclusions. So this program, it's called ARC, and we'll look at the program itself in a minute, would offer preferential care based on race and race-explicit interventions. According to, and this is illegal in itself because in 1964 we passed Title VI of the Civil Rights Act. No person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to the discrimination under any program or activity, including education, healthcare, housing, and social services. So the two authors that wrote this study and are advocating for this program, we're going to look at them in a second. They are Bram Weisel Wispelwey and Michelle Morse. Um, and they're aware that this is an illegal proposal that they want to do for this, Black and Latinx community. So what they're saying is they're offering preferential care based on race or ethnicity may elicit legal challenges from our system of colorblind law. They then attempt to justify their attack on civil rights by saying and qualifying that ample current evidence that our health, judicial, and other systems already unfairly preference people who are white, and that our approach is corrective and therefore mandated. So fighting racism with racism is essentially what they're saying. As evidence, they present their observations that white patients at Brigham and Women's Hospital were indeed more likely to be admitted to cardiology service than black patients. Um, and we're going to look at it, the data right now. So, in fact, the data linked by the authors does not support their argument. One of them linked is heart failure admission services, HFAST, racialized differences in perceived patient self-advocacy as a driver of admission inequalities. So already this is an interesting hypothesis with self-advocacy, but we're going to look at the article or the study here. And what's really interesting here is it says no significant differences emerged in admission to cardiology versus medicine based on age, sex, insurance status, education level, or perceived race and ethnicity. White patients were perceived as advocating for admission to cardiology more frequently, 19% versus 5.6, and more strenuously than black patients. And that's a p-score of 0.097. And we'll look at what p-score means, if this is statistically significant or not. ED clinicians more often reported having spoken with patients, outpatient cardiologists, for whites more than blacks. And that's a statistical significance of 0.069. So looking at p-values, a p-value higher than 0.05, and we'll look at these p-values. That one's higher than 0.05. This one is higher than 0.05, almost double that. A p-value of higher than 0.05 is not statistically significant. It indicates strong evidence for the null hypothesis, or for the other, the other argument being made. So, or the opposite of the argument they're being made. So really interesting that they're citing this study, which does not support their stance. And we'll look at that in just a second. The underlying ideology behind the attempt to impose race-based healthcare is known as critical race theory. And we all know and love critical race theory. It's now starting to bleed into a lot of the lesson plans for even our military, which holds that social inequality is caused by white racism against people of color. So what does this program advocate for? What kind of restitution does it seek? It looks like it's cash transfers and discounted or free care, expanded to the federal level to include taxes on nonprofit hospitals that exclude patients of color, or race explicit protocol changes. So now if you're not participating in these, how do we say, I want to say racist programs for black people, then now you're going to be taxed more heavily federally, is what they're advocating for. Really, really messed up stuff. I thought this was an interesting closing paragraph. I've never went to WSWS.org, but above all, calls for race-based healthcare are aimed at blocking the emergence of unified movement of the working class against corporate profits and the capitalist system that is a source of inequality, poverty, and racial discrimination. I think I could be more specific in who we could call out for racial discrimination, but we don't want to get banned. Genuine progressive movements have always fought for unity across racial lines. Which I understand, not the stratification division of the working class, and this is really important. A lot of you viewers, hopefully, are working for your family, trying to provide and give them the best life as possible. When we start to see division between race or age or any of these lines, they're distracting us from the true division. And I think you guys can get a hint for what I think that division is, and it's definitely not left versus right. So we're going to look really quick here. An anti-racist agenda for medicine. So there's one paragraph here which talks about the program specifically. This is exactly what we have tried to achieve in the new design for a pilot program at Brigham and Women's Hospital, set to launch later this spring. Adapting Darity's reparations framework for acknowledgement, redress, and closure, ARC, to an institution level, we have designed a program, we call it a healing ARC, with initiatives for 3 components. Each centers around Black and Latinx patients and community members, those most impacted by unjust heart failure management, under whose direction appropriate restitution can begin to take shape. So really interesting. I think what we're seeing is an overcompensation going on in the racial space. And we're starting to see what appear to be scientists not even actually honor or respect the data that they are informed off of. They're letting their bias completely override whatever reality exists in advocating for policies that could be dangerous, very unethical to certain groups. So anyway, guys, thanks for joining. I wanted to cover that. I thought that was interesting. If we see this kind of stuff continue, what kind of trajectory you're on for 10 years from now are the questions I start to ask myself. All right, guys, have a great weekend.